Good evening. It's 8 p.m. It's February 10th, 2021. Today we have Dr. Carr and Dr. Delius. Did I say it right, Dr. Delius?
Dalianis.
Delius.
Yes.
Delius. I
Got it.
wrote it down a certain way so I can remember it, and I still got it wrong.
That's okay. It happens.
So, they're here today to discuss public health. They've just started a public health program at the college that they're both instructors, and I'll just let this podcast roll, and it's all theirs. Tell us about everything, doctors.
Hi, good evening. This is Dr. Carr. Just wanted to jump in and talk about public health right now. You can't exist in the world without hearing the importance of public health. And the goal of public health and the perspective of public health is to provide health care, avoid injury, prevent injury, provide health care from a proactive perspective versus a reactive perspective, which is the perspective of most healthcare areas that we know of. Public health efforts are used to improve community health as well as to assure that those that are in underprivileged communities and also vulnerable populations are given the opportunity to improve their health by educating, also implementing services, and just the overall goal is to improve the overall health of society.
Absolutely. And just to add on to that, public health is about prevention. It's about setting up the conditions for people to thrive and be healthy. So we want to create environments. We want to provide resources, provide education so that people have what they need so that they can be healthy, so that we can prevent disease. Also, so that we can help prevent complications of the illnesses that are already in progress as well. But we really want to prevent an illness with a special focus on communities that don't have access to what they need to be healthy. They've been, the society has limited their access to what they need to be healthy and thrive. So it's really a community focus, a macro level focus, and about creating conditions to be healthy.
That's
Absolutely.
a good point. I said I was going to just listen. Doctor, what do you mean society have limited their access?
Yeah, society has been set up in a way that has created health disparities, which Dr. Carr mentioned as well. We have, one example would be that we have neighborhoods that do not have grocery stores in them, for example, and that makes it more difficult to grocery shop for fresh items every week if you have to travel far or it's hard to get to the grocery store. We have food deserts. So that's a societal condition that really limits people's ability it can limit someone's ability to eat healthy, for example.
Great point. Great point. I remember going to Philadelphia, and my sister introduced me to this place called Dr. Carr, what's the name? Produce Junction. And I went into Produce Junction, but I had to drive to Produce Junction, and Produce Junction is a good distance away. So it's good that they have this place, but as you mentioned, I had to jump in a car and drive a few minutes just to get to Produce Junction. And the first Produce Junction, which is closer to the city of Philadelphia, is not as good as the one further away, more in the suburbs. The one in the suburbs has so much of variety, and the one closer to the city does not. But I'm happy it exists. It existed, but it did not have the variety. So I truly understand and I see where you're coming.
Absolutely. Just to piggyback off of what Dion said with the availability of produce, there are some produce junctions in the city of Philadelphia itself, but those produce junctions are usually in communities with more affluent populations. And so, a goal of mine as an educator for my students, one of my main goals is to not only make them knowledgeable of disparities, the effects of harmful foods, and in addition to learning about harmful foods, but just to kind of set up the dynamics where we realize that supply and demand kind of control society. And like Liz said, the way that the society is set up, it's intentionally set up so that the poor communities do not demand those things like fresh fruits and vegetables. So that can be an excuse of why they're not there. But as we all know, knowledge is power. And if you don't have the knowledge of the benefits of fresh fruits and vegetables and things of that sort, what are you going to do? You're not going to know what the benefits are. And if you are, maybe it might be by accident that you found out. So one of the things and the goals for me with my students is have them become change agents where they will dictate what the needs are in the community by advocating for community residents, also educating them. One of the things that we also pointed out with this public health thing is that a lot of times most of the educational sessions that are done, and I believe we talked about this before, are done by those who are not in the community, who do not have a connection, which kind of leaves community members a little reluctant to trust, right? And so the goal is to educate, have more people on the forefront, let them know what the effects are, good food, bad food, and how it affects not only just your overall, your mind, body, and your soul. And so the goal is to have them advocate and to educate through local schools, through recreational centers, through local churches, local health medical centers, wherever, where they can penetrate that population. And so we can change the narrative that we do not have McDonald's and on every fifth corner, but hopefully in the next 10 to 20 years, we will literally see produce junctions with fresh fruits and vegetables on every fifth corner.
Not just to piggyback off of that, I think that's going on. All of those topics and areas that you just touched are the same as going on in underprivileged communities with the vaccines.
Absolutely.
Definitely.
And now they're touching on churches. They're touching on all of those areas that you just touched to get the vaccine out.
Right.
It's so funny because I can't remember what arena that someone, and then this is why it's so important that people like Liz and I who have a public health background and know the importance of community are involved in this process, because right now in Philadelphia there's a debate. Liz, I'm not sure if you can remember, but there's a debate of using one of our arenas. I can't remember if it's the football stadium or the base. I don't remember which stadium it is. But right now there's a debate on whether or not to use the stadium as a hub for vaccines. And that sounds great. But even if you do put the vaccines in those areas, will those local residents from North Philadelphia, Southwest Philadelphia, from West Philadelphia, how will they access them? So
they
these
get
are
there,
things that
exactly.
Yeah.
Do those locations have the same trust that a neighborhood organization has? Yes, maybe not, right? So it can be better to have facilities in people's neighborhoods with people faces that people recognize that they know, because it's important to have that relationship, to have that
Exactly.
community and that trust, especially with vaccines. Especially with vaccines. It's really important that that prior relationship is there and that trust and understanding between people is there.
Exactly. And I think I mentioned before, and I'm so passionate. We talk so much, Liz and I, and then I talk to Dion and Liz about public health. But I think I mentioned before that we need to use local leaders, even if they're standing on the side of those promoting the vaccines. We need to use local members of our community so community members can see familiar faces that they trust.
And there has to be open dialogue. Yeah, it's just the relationship has to be built, nurtured to do public health, to do good public health.
It's Liz number two. You said something that was so important. We just ran a pop-up community vaccine out of a youth and community center in the center of town where there was public transportation, and we actually had community members that drove volunteer to go pick up others that did not drive, could not walk, were handicapped, and it was such an amazing event. 213 vaccines given out, and it was efficiently done, and the community members were, some of them had not been out of the house since the onset of the pandemic in February of 2020. Some of them were crying. They were overcome with joy. They came as families. They came as friends, and we saw a 102-year-old woman. We saw a lot of Vietnam vets, and we got a very diverse population of the community vaccinated, and it was just a wonderful event. So I couldn't agree more. Didn't realize how important that was before this event, but volunteering for this event and having an experience like that solidifies what you just said. I think it's really smart.
I know Liz and I often praise our organization, but I must say they have really stepped up. And I know they step up, and I've always said they step up, but they have opened pop-ups in the communities. They have opened pop-ups in the middle of communities to get um, people of color, underprivileged, vaccinated. And it is so impressive to see an organization who is based not in those communities go to those communities to make sure that
Yeah.
everyone gets a vaccine equally.
And at first it was voluntold and volunteering. And I went in there with the mindset of I'm going to volunteer and I'm going to dedicate a Saturday that I would normally stay at home or go shopping or do something fun or do nothing at all. And I ended up thinking I'm going to volunteer for the benefit of the community. And when I left feeling, wow, this really impacted me and this was so good for my soul. I really needed it. It was really great.
That's good to hear. That is really
That sounds
good
like
to
a great
hear
event.
that measures are being taken place because it is very important that we have people who are capable of one. Not only are those local communities lacking income, but they also lack in resources. So it's great to see such a large hospital who really don't have to reach back to those smaller communities. Just invest the time into making sure that all of the residents of our society is taken care of. That's really impressive.
Yeah, another thing it makes me think of, just building off what Dr. Carr said, that everyone really has their piece within public health, and you might not think that what you do is a part of public health. Anyone in any given